Welcome to Part B of Chapter 6, Integument. We'll be covering the last 4 objectives, including summarizing skin color and its causes, describing accessory structures like glands and hair, looking at the skin's role in body temperature regulation and how wounds heal. Lastly, we'll take a look at different types of skin cancers and disorders of the integument. Skin color is determined by different pigments like melanin, hemoglobin, and keratin. It's also determined by the amount of blood circulating through your skin and the thickness of the most exterior layer of the epidermis, the stratum corneum, the corny layer. Keratin is yellow. It's a yellow pigment and it accumulates in the stratum corneum and in the fat cells of the dermis and underneath the dermis, so right around here. Now, this is important to note that a mother feeding her baby too many sweet potatoes or carrots or anything high in keratin, which gives those vegetables their characteristic orange color, their baby can actually result looking yellowish. So a lot of people think that's jaundice, another condition, but it's actually just too many of those nutrients. So as soon as that baby stops eating that, they'll return back to their normal skin color. Melanin is produced by melanocytes. We talked about that earlier. Melanocytes are found right here in the basal layer of the epidermis, right before you hit the dermis. And melanocytes give you your skin color. The differences in pigmentation among people is determined by the amount of melanin that's produced by melanocytes, not the number. So actually, albinos, which are people that have no melanin production or very limited melanin production, have the same number of melanocytes, but they do not have the type of activity where melanin is actually being deposited in the epidermis. So melanin is made here and travels up through the cells as they undergo keratinization, which we talked about in part A. Sweat, aka sudoriferous glands, result in a filtrate of plasma working their way up, right up here, through a sweat pore. Notice that sweat glands are not really associated with the hair follicle. The type of gland associated with the hair follicle is a sebaceous gland. Merocrine, eccrine glands are the most common, and these glands are found in the palm, the sole, and the forehead. These are odorless sweat glands. Apocrine glands release fatty acid. These sweat glands are found in the axillary and anogenital regions. So you will see that in response to stress and sex, you will have particular types of sweat coming out with fatty acid. Bacteria will feed on the sweat because it's fatty in nature, so that causes body odor. And body odor has a name, it's called bromhidrosis. Ceruminous is a modified apocrine gland, and that is ear wax cerumen. And mammary glands are also a type of gland that secrete milk, and those are apocrine as well. Sebaceous glands are simple alveolar glands, and they secrete sebum, which is a fatty, oily secretion. And this occurs all over the body, but not the palms and soles. So palms and soles will only have sweat glands. The rest of the body will have both. Human hair is made out of keratin, which we talked about being developed in about the second stratum of the epidermis. It's lacking on your soles, your palms, your toes, fingers, lips, nipples, and part of the exterior genitalia, as well as the distal segment of fingers. 75% of all the hair on your body is located on your body surface, not on your head, and there's 3 different types of hair. Lanugo is fine, unpigmented fetal hair. Developing children have lanugo. Thallus is the fine, unpigmented hair of children and women, and you can find this on their faces. And terminal hair is the coarser, longer pigmented hair of the scalp, eyebrows, the axillary, and the pubic regions, where we normally think hair. Hair has, if you take a look at a cross-section of a hair follicle, you'll actually see that the hair is made out of 3 major areas. The medulla is found straight in the center of the hair follicle, the cortex is the middle, and the cuticle is the outside end. Everything else here correlates to this cross-section on this picture. So not only are we looking at the hair itself, but also the sheath. So the yellow part to the beige part, the sheath that surrounds it at where the hair is living. So why do you need to know this? Because hair is also pigmented as well by 2 types of melanin. Eumelanin, which is associated with black and straight hair, and pheomelanin, which is associated with blonder and lighter types of hair. Now you can have different types of melanin being produced at different amounts, and that's what ends up giving you your brown, black hair, blonde hair, red hair, and everything in between. For people that are getting older, they actually lose the medulla, and the medulla is actually full of air, and there is no pigment in the cortex area. Gray is the default color. Now, taking a look at regulation of body temperature, the only type of regulation we'll talk about here is two types: sweat glands and how sweat glands secrete sweat. Sweat ends up on your skin, and as that water, that plasma filtrate, evaporates, that cools your body. Your body temperature can also change because your body can open or close your blood vessel. When you are hot and your temperature increases, your blood vessels open up to release heat, have more blood flowing through the vessels, and that means that more heat is being lost across the epidermis. When your body is cold, you actually have to keep your body heat in. Your vessels undergo constriction. Vasoconstriction, less heat. Heat is still lost, yeah, but it's actually less heat than if the vessels were dilated or opened up. When we refer to the healing of cuts, it's really simple to understand. So starting with A, just normal everyday skin, and B, you can note that there has been some injury right here brought to all the way to the dermal layer. And B, you can note that some injury has occurred that crosses not only the epidermal layer but goes all the way into the dermis, and that's called the site of injury. Blood cells start accumulating, fill that gap up. Soon, blood cells are not the only ones going to this area. You'll also have the mast cells, macrophages, fibroblasts, making collagen and fibers and other things are going in there. So it's a whole production. And a blood clot forms, including blood cell. Finally, a scab forms. Fibroblasts finish their jobs by continuing building the dermal layer, and the scab falls up. And now you have a different pattern emerges that looks like scar tissue. So it's a different pattern of what the epidermis look like. So if you have a few minutes, you can actually take a look at skin graft right now. The process of using synthetic skin to increase the rate of healing. And so what doctors do is they patch the synthetic skin over the opening, and the patch has chemicals that trigger healing very quickly for skin regeneration. They remove the silicone membrane after some blood flow has started. They put a skin graft of the patient's own skin on top where the membrane used to be, and the skin graft eventually becomes new skin from the patient's own old skin. Taking a look at different disorders of the integument, one of them is skin cancer. Cancer, as you remember, is uncontrolled cell division and growth. So basically skin cancer, it refers to cells that are undergoing high mitosis rate. Three types of skin cancer. The first one is basal cell carcinoma. This is the most common, and it is the largest of the non-melanoma type. This is a cancer of the keratinocyte at the stratum basal layer. So this is the very bottom. Basal cell carcinoma accounts for 80% of all cancers. It's easily removed through surgery or through excision or removal of the skin of sun-exposed areas. Squamous cell carcinomas account for 25% of all skin cancers, and there's a good prognosis that you can survive squamous cell carcinoma. This again is a keratinocyte cancer of the stratum spinosum, and malignant melanoma is the least common but the most dangerous. This is the cancer of melanocytes. Your melanocytes receive too much UV radiation. Radiation changes DNA, and then the DNA is mutated as a result. Due to this mutation, the melanocytes start dividing and dividing some more, and soon you have a tumor, which can lead to full-fledged cancer. And the cancer, melanoma type cancers can spread throughout the body. This often arises from a pre-existing mole as well. We're going to talk about the ABCD rules, but first I want you to take a look at melanomas right here. Notice the epithelium is in purple, the dermal is in light pink, and remember that the melanocytes are hanging right here at the stratum basal layer. The melanoma again is cancer, so cancer's high mitosis rate. And here are the ABCDs of skin cancer. So when you're taking a look at a mole, and normal moles are on the left side right here, you want to check for asymmetry, and you want to make sure that half of the mole matches the other half. So in melanoma, you take a look here and you notice that there's no asymmetry. You want to take a look at the border. If you have a tight border, nothing's irregular, that's a mole. Melanoma, you'll see that the border is ragged or irregular. You want to take a look at the color, and you want to make sure that the color of the mole is one color. In melanoma, it varies throughout, so you can see a patch here of light brown and dark brown patch here. And you also want to take a look at the diameter. If your mole is a pencil eraser's diameter or less, and the mole begins to grow out of control and to more a diameter that's bigger than a pencil's eraser diameter, you can check for that. Okay, so this is the end of the presentation, so feel free to open this the actual PowerPoint, because the PowerPoint goes on to other questions. I'll give you a quick flash through with the answers. Good luck on your test.